This is part 2 of a series of lectures on antimicrobial resistance and antimicrobial stewardship in veterinary medicine. In this part, we will be talking about the pharmacokinetic factors and the pharmacodynamic factors that influence usage of veterinary antimicrobial drugs. Effective antimicrobial therapy depends on an interplay between the susceptibility of the organism to an antimicrobial agent and the concentration of that agent that can be safely achieved at the site in the body where the pathogen is located. So in all antimicrobial therapy, we are balancing the effect of the drug on the bug with the effect the drug may have on the patient, given the dose sizes and frequencies we need to use to achieve high drug concentrations in the infected tissues. You should always use an antibiotic to which the organism is known to be sensitive. Rational choice of an appropriate antimicrobial requires a clinical diagnosis, and preferably an etiological diagnosis. Antimicrobial susceptibility of gram-positive bacteria, except for the staphylococci, is fairly predictable, but antimicrobial susceptibility of gram-negative bacteria is generally unpredictable because of transferable drug resistance, and as a result, in vitro antimicrobial sensitivity testing is recommended. Antibiotic therapy should be strong enough, in terms of the dosage size and interval, for long enough in terms of the dosage duration. That's really a key requirement of all successful antimicrobial therapy. Penetration of drugs into infected foci depends on passive diffusion. The rate of diffusion depends on drug concentrations in plasma and extracellular fluids and is determined by the dosage size. The main factor that limits the size of the dose that we can administer is the toxicity of the drug for the animal. Dosage must be reduced in neonates and animals with impaired kidney or liver function, as these animals are more likely to accumulate toxic concentrations in the plasma. In the example shown on this slide, plasma concentrations of a hypothetical antibiotic are shown over time after a single dose. The peak plasma concentration, or the Cmax, was reached 2 hours after dosing, and the plasma half-life, or the T-half, was 2 hours. The dosage interval is determined by the half-life, which is the time required for the plasma concentration to decrease by 50% due to elimination. The half-life varies with the type of antibiotic and how it was formulated, but it's independent of the size of the dose. Parenteral injection is used for serious acute infections and for species such as horses and cattle. Intravenous administration achieves high initial plasma concentrations and rapid distribution to other tissues. The high concentration gradient facilitates passive diffusion across the cell membranes and the cellular barriers. Intramuscular and subcutaneous administration is a favoured approach for ongoing therapy in individual large animals. Oral administration is used for mild to moderate infections for species such as dogs and cats because it is more convenient, and for agents such as tetracyclines and erythromycin, which are irritant when given by injection. Oral administration via feed or drinking water is used for mass medication of poultry and pigs, where individual animal treatment is impractical. The 3 pharmacokinetic factors that influence drug concentrations in the tissues, where they will have their effect, are its bioavailability, distribution, and elimination. This graph shows how absorption can be calculated by measuring plasma concentrations over time. The rate of absorption is estimated from the peak maximum plasma concentration, or the Cmax, and the time at which the peak concentration is reached, or the Tmax. It can also be estimated from the peak maximum plasma concentration divided by the total area under the plasma concentration time curve, or the AUC, expressed as units of reciprocal time. For injectables, bioavailability is influenced by dosage form and vascularity at the injection site. Injectables may be formulated as solutions, suspensions, or soluble powders, and long-acting formulations provide a slow, continuous absorption. However, the rate of release of long-acting injectables must be adequate to maintain effective plasma concentrations for the whole duration of the dosing interval, with antimicrobials that exhibit time-dependent effects, something we'll discuss later. For oral use, bioavailability is influenced by more factors, including the rate of dissolution, the stability in the GI tract, the drug's ability to diffuse through the mucosal barrier, and the time of feeding relative to dosing. A high intravenous priming dose, particularly of bacteriostatic agents, can be used to rapidly establish therapeutic levels. These oral formulations may be tablets, capsules, boluses, liquids, soluble powders, suspensions or pastes, and the bioavailability can vary with that formulation. The volume of distribution is a measure of the relationship between the amount of drug in the body and the concentration in the plasma. It's a measure of the extent of distribution of the drug and is influenced by the blood flow to tissues, the pH of the tissues, the peak plasma concentration, and the diffusion characteristics of the antibiotic. Drugs that are highly protein bound, particularly those with protein binding of above 80% in the plasma, penetrate less effectively and can have reduced activity because only the unbound portion exerts an antibacterial effect. Some antibiotics are eliminated almost entirely through the kidneys, while others are metabolized in the liver and then eliminated through the biliary tract, with a smaller proportion of them excreted unchanged in the urine. Lipophilic antibiotics, including fluoroquinolones, macrolides, lincosamides, trimethoprim and metronidazole, all of which are weak bases, and chloramphenicol, which is neutral, penetrate cellular barriers and enter most tissues. They have high volumes of distribution and are mainly eliminated by hepatic mechanisms, including metabolism and biliary excretion. Tetracyclines vary in their lipid solubility. They enter most tissues and body fluids, especially the more lipophilic compounds such as doxycycline. Most are slowly eliminated, mostly unchanged in the urine, with excretion prolonged by intrahepatic recirculation. However, doxycycline is excreted in the faeces. The required duration of treatment varies with the type of infection. Clinical experience in assessing response to treatment is important. If there is no progress after 48 hours therapy, diagnosis and/or treatment should be reassessed. As a general rule, therapy should continue for 48 hours beyond clinical or microbiological resolution. Serious acute infections usually require treatment for 7 to 10 days, but chronic intracellular infections may require prolonged therapy.